Hello, I am Dr. Shrikant Bhoyar. I am General and Diabetic Food Surgeon practicing in Mumbai. We have two clinics. One is in Borivali East and another is in Borivali West. I am attached to hospitals like Bhoyar Hospital Mumbai as well as APEC Multi-Speciality and Super Speciality Hospital in Borivali. You all will agree that feet are worshipped in India, but they are the most abused and neglected part of the body. We look at our face at least 3 to 4 times in a day in a mirror, but we hardly look at our feet. And when we look at our feet, when there is any injury and when there is a pain, imagine in a diabetic patient who have developed neuropathy and there is a loss of sensation in the foot become insensate, so their injury must be getting unnoticed. So imagine a nail has pricked into the foot and this person will not come to know about that injury. And when he will come to know about injury, when there is a bleeding from that foot or when there is an infection and there is a foul smell. By that time it becomes very late and there is no other alternative than to go for amputation. So prevention of this amputation is very much important when you give very much importance to your feet, especially the diabetic patients. If you look at the diabetic patients, why these ulcers or injuries occur? There is a neuropathy, sensory neuropathy, motor neuropathy, autonomic neuropathy. In sensory neuropathy, there is a loss of complete sensation. Touch, pain, temperature sensation is lost. So the patient can come to you with a nail injury, or if the patient go to for example to the temple in a hot summer and remove their footwear outside, he can develop burns. If you are going on the beach without a footwear, he can develop burns on the foot also. Sitting on the motorcycle can have a silencer injury. Like that, they can get many times lot of injuries and that can land up into a problem. Because of motor neuropathy, the muscles of the foot becomes weak. There can be more weakness on some side, more weakness on the other, less weakness on the other side. So the biomechanics of the foot changes and the pressure comes on the foot at some other place, some other part where they will develop a thickness of the skin that is called as a callus. If the callus is not removed, debrided at a proper time, they can develop into ulcer and the ulcer can get infected and then again land up into a amputation. When there is autonomic neuropathy, there is a loss of sweat secretion is there. That's why they can develop the cracks, and through the cracks again the infection can go into the foot and can be a cause of again ulcer, infection and amputation. So to prevent that, ulcer treatment is very much important. 85% of the amputation starts from the ulcer. So healing of the ulcer is very much important. In our clinic, there are lot of modalities with the help of which we heal the ulcer. If the patient has developed already ulcer or infection, we have other modalities with the help of which we can remove the infection. If there is a vasculopathy, there is a loss of blood supply to the foot and because of which they can again develop a gangrene and amputation. So angioplasty and bypass also can be done for this type of patient to prevent the amputations. So generally I will say, take care of your foot as you take care of your face, and for that proper foot care is very much important. We call this the 10 commandments of diabetic foot care. In our patient, for normal diabetic patient, we give this pamphlet to the patient with the help of which he can take care of his feet. But even though he develop ulcer, we have other modalities also with the help of which we can heal the ulcer. Thank you so much.